Good evening, everyone. My name is Lee and I'm a Vice President of Mcure. We will now start today's webinar. Thank you very much for attending Mcure's International Webinar 2024 today. We sincerely appreciate your coming after your practice all day. We invite Dr. Gi-Young Yu, Director and owner of Maylin Clinic Lotte Hotel in Korea tonight. Before his lecture, I would like to inform you how to use the simultaneous interpretation. If you are attending with your PC or tablet, please click the interpretation icon at the bottom of the screen and select Japanese. If you are attending from a mobile phone, please click on language interpretation from the other menu and select Japanese. If the original audio is so loud that you cannot hear the Japanese interpretation, or if you want to hear only the interpretation, click the interpretation icon again and select Mute Original Audio. Please note that the simultaneous interpretation function does not exist in other versions of the Zoom app. There will be time for Q&A after the lecture. If you have any questions, please type them in the Q&A box at the bottom of the screen and send it to us. Questions can also be submitted during the lecture. Now, Dr. Gi-Young Yu. Dr. Yu graduated from Dongguk Medical University in Korea, worked at Dr. Designer Clinic Jamsil in 2020. And since 2021, he has been the director and owner of Maylin Clinic Lotte Hotel. Now, his clinic is very popular in the aesthetic dermatology field in Korea. He specializes mainly in anti-aging treatments such as lifting and has gained the trust of many patients. In addition to being a KOL of today's machine short micro subcision injector, he also serves as a VIP doctor for Lijuran and instructor for lifting and filler treatment. He's an up-and-coming young doctor who is a member of many medical societies. He will talk about his extensive experience in short micro subcision, especially in the treatment of rejuvenation, scarring, and deep wrinkles, including the tip and clinical result. Now, Dr. Yu, please start your presentation.
호스트가 비디오 한번 구면 안 돼요? Hi. Let me start. Before I start, I'm very glad to meet you doctors in Japan. And I'm honored to be with your webinar program today. Let me introduce myself. I'm the representative doctor of the Maylin Clinic in Jamsil, Lotte Hotel in Korea, Yoo Ki-eun. And I found out for the first time while preparing for this webinar, there is no Lotte Hotel in Japan. Anyway, today I have prepared a presentation titled as New Treatment Method with CO2 Micro Subcision Injector for Acne Scar, Deep Wrinkle, and Rejuvenation. Before we start, what I want to say today is that there are some problems to treat deep wrinkles, acne scar, and rejuvenation in not only Korea, but also in Japan. Although we try to treat with diverse machines like a microneedling or RF machine, it is difficult to achieve enough patient satisfaction. So today, I will show you a new method for deep wrinkle, acne scar, and rejuvenation with my clinical experience and would like to discuss with all of you. This device injects CO2 gas and a solution separately and simultaneously, so you can consider it as a CO2 subcision injector. What I'm saying, let's first see the mechanism. Typically, when using other devices that utilize CO2 gas, you know that the procedure involves inserting the needle, injecting CO2 gas, and removing the needle, then reinserting the needle, injecting the solution, and again removing the needle. This process is repeated iteratively. However, this device differs from that approach. You can freely choose injection of CO2 gas or solution with one needle insertion. In this process, by injecting CO2 gas, you can expect two effects. First, the physical effect of subcision and solution spread, and second, the physiological effect with the Bohr effect. Let's see one by one. First, about subcision of physical effect. As you know, subcision word is a short form for subcutaneous incision, also known as dermistomy. It is a treatment method to cut the adhered skin tissue to improve a scar or wrinkle by needle or cannula. This device can do a subcision by not only needle or cannula, but also CO2 gas pressure. So it can help to do a subcision easily and more perfectly. Second, about spread solution of physical effect. A photo A was taken with this device, injecting gas, solution, gas in that order, while photo B was taken with only the solution injected without the use of any equipment. You can see that this device can spread solution widely and evenly by injecting CO2 gas both before and after the solution into the skin, like this test picture. So solution will spread evenly in the skin, like this test picture. Third, about Bohr effect or physiological effect. When the partial pressure of CO2 gas in the skin is high or the pH value is low, like acidic state, the degree of oxygen dissociation of hemoglobin that carries oxygen increases. So increased oxygen makes to enhance blood flow by stimulating various growth factors, and increased oxygen also make to maximize solution effect by activating the intracellular target area. So I use these effects for scar and wrinkle treatment and even for skin booster. Personally, I tend to use it more for skin booster. Let's see one by one. As you know, when I treat scar, wrinkle using this device by manual, there are 7 steps. Step 1, you first need to assess the treatment area, including wrinkles or scars. Here, the term scar refers to atrophic scars such as rolling box scar, ice pick, and does not include like raised scar like hypertrophy or keloid scar. Step 2, insert the needle in dermis layer. Step 3 and 4, insert CO2 gas and continuously inject CO2 gas. And 5, 6, if you think it is enough to subcision, withdraw the needle while injecting the solution retrogradely into the subcised space. Then you can see an increase in volume. Let's see the process through a video. As I mentioned, injecting CO2 gas while withdraw, and it is enough to subcision. Withdraw the needle, inject solution retrogradely. During this process, you can expect the previously explained mechanism, subcision, Bohr effect is to be applied. As I explained, on the subcision side, cut the adhered tissue and collagen regeneration, and on the Bohr effect side, increase solution absorption and collagen regeneration. Furthermore, after the procedure, the injected solution helps prevent the re-adhesion and simultaneously, depending on the solution used, injected solution can help to enhance the skin regeneration effect. Next is the skin booster that I make more use of this device. For the skin booster treatment, the device do 3 processes in one shot. First, inject CO2 gas. Second, inject solution. Third, again inject CO2 gas in one shot. When seeing the effects of the first and third step in this process, first gas makes a subcision as a physical effect, make a room for solution, and making the physical damage by pressure of CO2 gas, it induces collagen regeneration. Third gas makes to spread solution evenly, prevent the side effect like nodules of PLLA, as you know, and make uniform injection for better effect like rejuvenation. You can also expect a Bohr effect as a physiological effect while injecting first and third gas, because blood circulation is increased by Bohr effect, solution absorption and collagen regeneration increased as I explained before. And when using this device for a skin booster, a suitable handpiece is used to inject the solution only into the dermis layer of the skin. Comparing this method to manual subcision, it presents several advantages. As I explained earlier, this device uses CO2 gas, needle, cannula for subcision together. So treatment time is short, pain is low, downtime is short as you expect. Especially CO2 gas subcision makes better subcision than needle subcision alone. Let's see the animal tissue test video. CO2 gas subcision versus manual subcision. As you can see, the left side, injection with CO2 gas subcision, injected CO2 gas make like a subsized room for solution. Make a room for solution, and as you can see, so injected solution spread widely and evenly, while on the right side, injection with only manual subcision, as you can see. Additionally, injected solution along with subcision can reduce the extent of readhesion compared to when subcision is performed alone, as you can see this diagram. Here, you might wonder if it is possible to use other device that inject only CO2 gas. However, as in the diagram, this device can perform CO2 gas subcision and solution injection during just one step. This leads to an enhancement in the overall precision of the procedure compared to the procedure with two steps. About side effect, especially in skin booster procedure involving the injection of like PLA, PLLA, or PDLLA, the use of CO2 gas can facilitate effective dispersion of the solution, potentially reducing the side effects such as nodules. Let's see the one more animal tissue test video. This device makes better injection and dispersion of the solution than normal injection. On the left side, about 3 steps injection. As I explained, 3 steps consist of injecting gas, solution, gas, and in that order, as you can see. So comparing with right side normal injection, like this, a 3-step injection can get better injection and spread solution. And various solutions such as PDRN exosome PLA and HA can be used with this device. Then why we use CO2 gas for subcision, not just like air? Simply using just the air can lead to the side effect of blood coagulation. Therefore, instead of air, CO2 should be used. Let's see the evidence for the specific effect when CO2 is used by examining several research papers. First, you can see CO2 gas subcision has less hematoma and bruising than traditional manual subcision. And in tissues exposed to CO2 gas, there is an increase in blood flow and capillary formation. And increased blood circulation lead to enhanced drug absorption. And the extent of skin collagen production is superior when CO2 gas and HA are sequentially injected compared to cases where only HA is injected. In addition, there are various research papers on the effects of CO2 gas. Also, there are many doctors posts on the effects of the device because they say the same contents I explained. I will move on this part quickly. It's me and my post. And about procedure, there are three methods. First, auto-injection type is widely used for skin booster. And I said before, I tend to use this device for skin booster, so I use auto-injection mode the most. Here, you might wonder if it is possible to suck only skin layer, not including fat layer. So looking the tip more closely on the first picture, you can see that there are three guides inside of the tip. And on the second and third picture, if you attach the needle with the tip, only 1 to 2 millimeters of the needle is exposed, including needle bevel. So when you do a procedure, a skin booster with this device, the skin layer is sucked through a vacuum process, and the needle is inserted only up to the dermal layer because the guides block the skin layer rising further. After that, injecting CO2 gas, solution, CO2 gas, according to the three steps only onto the dermal layer, not fat layer. Second, when I want to inject CO2 gas and solution sequentially, I use manual injection type. It can allow you to operate freely and offers a wide range of application. Third, ibuprofen type is used for injecting CO2 gas only. As you can see, it looks like a pen, so you can use it more freely than the manual injection type you saw earlier. From now on, there are some cases using this device. About a forehead wrinkle, you can see improvement in forehead wrinkle using solution PLA and thread. And also, you can see an improvement in nasolabial fold. Also, you can see an improvement in wrinkles after 4 weeks. And about neck wrinkles using solution HA PDRN. Here, HA is, cross-linked HA filler, which is low viscosity. Like I don't know if you know, but product name as like Belotero Soft. Also, you can see improvement in the neck wrinkle using solution PLLA. Also, improvement in scar after 6 weeks from the first procedure. You can see a slight improvement in stretch mark using HA plus PDRN. And you can see improvement in acne scar using HA. Here is filler. A scar and skin tone improvement in acne scar and tone using HA, but not filler, non-cross-linking HA. S2. Now, this video was taken about a week ago. I couldn't wear gloves during the procedure, but I, of course, did sanitize my hand. This is a demonstration of using the Alpha pen for the procedure. And when doing subcision, I typically use thick needles like 18 or 19 gauge, like Noko needle. However, in this video, as you can see, I use thin needles of 27 gauge because the scar was not severe enough to require thick needle. Only just use shot gas. This is right after a procedure. You can feel the dissection is going well. And this video shows PDLLA, like Drew Barrow skin booster treatment using auto injection. In Korea, most used PDLLA product is Drew Barrow. As you know, considering that PDLLA is often clogged during skin booster treatment if it is not hydrated enough, the procedure can be performed easily by auto-injection with less side effect. As you can see, first, the skin layer is sucked through a vacuum process and the needle is inserted only up to the dermal layer. After that, inject CO2 gas solution and CO2 gas according to the 3 steps. This video shows HA filler treatment using continuous mode injection. In this mode, you can freely choose and inject CO2 gas and solution. Needle gauge is 27 gauges, so thin needle. When I said earlier, when I treat on shallow wrinkle, usually use like this thin needle. First, I injected CO2 gas several times for subcision on a line with a wrinkle. And if you think it is enough to make a loom subsized, withdraw the needle, inject the solution retrogradely. Then you can see a slight improvement in forehead wrinkle only just with HA filler after 9 weeks. Last, I summarized the content briefly in 6. 1. Treatment for rejuvenation and scar management is always focused in aesthetic medicine. 2. CO2 micro-subcision is effective. 3. There are less leakage with air pocket made by CO2. 4. Scar and deep wrinkle needs several sessions. 5. You can make many treat menu with this device. And last, we should share more clinical results among international doctors to cure patients. Thank you.
Okay, thank you very much for your valuable presentation, Dr. Yu. We have received some questions for Dr. Yu. So we would like to move on the Q&A session. So if you have any questions, please enter them in the Q&A box at the bottom of the screen. So first question is, at a vertical injection, how much is the leakage of solution, especially compared with Mulgang injector?
Sorry, again?
Okay, first question is, at a vertical injection, how much is the leakage of solution, especially compared with Mulgang injector?
The CO2 subcision injector has less solution leakage than normal injector because the CO2 gas maker, I mentioned, a space for the solution before its injection. So I think with the proper needle gauge, drug leakage is almost non-existent.
Okay, thank you for your explanation. So let's move on to the next question. Okay, how can we understand we can cut the adhesion after the short gas injection? The adhesion area of acne scar is very strong, so I would like to know.
화면으로 표시해 주셨으면 좋겠는데 지금
풀 화면이요? hold on.
Okay.
PPT? 하는 거예요? 네. Sorry, again.
Okay. How can we understand we can cut the adhesion after the short gas injection? The adhesion area of acne scar is very strong, so I would like to know.
Right. Strongly adhered scar is not perfectly cut by CO2 gas alone, of course, because the tissue is too tight. However, it was observed that combining the CO2 gas subcision with needle subcision significantly enhanced the effectiveness of the procedure. In other words, it makes sense that CO2 subcision injector enhanced the effectiveness of the needle subcision. As we watched in annual tissue test video earlier, we can observe that the CO2 subcision injector make better subcision than needle subcision alone. Additionally, I have confirmed this through several clinical cases as well.
Thank you for your detailed answer and explanation. There are many questions, so I move to next question. Yes, I used lidocaine cream before the procedure with this machine. Many patients are fine, but quite less patients sometimes claim the pain. Do you use different anesthesia such as laughing gas or perhaps combination of these or any other ways?
Of course, I also use a lidocaine cream, called EMNA. However, as you said, if only lidocaine cream is used, most people complain of pain. So I use local anesthesia, nerve anesthesia, nerve block, like infraorbital nerve block, and ento gas called laughing gas, and sedation as needed. For example, when doing a skin booster treatment such as Rizuran or Juverup with a small amount of 2 to 3 cc, nerve block or laughing gas anesthesia is often used. When the amount of skin booster treatment is about 6 to 9 cc at once, sedation anesthesia is usually used. Of course, nerve block is also performed during sedation.
Thank you for the answer with the specific example. So let's move on to the next question. How many times do you recommend patients to come to clinics for severe acne scar and rejuvenation on average, respectively?
Actually, I tend to perform a combination of all procedures. For patients with severe acne scar, the treatment is basically done by combining a fractional laser or picofractional laser with this device with Rizuran or Zuberu. You mean in this case, I would say that approximately at least 5 times is necessary, at least.
Thank you for your answer. And I choose this question. Next question is, do you often use short gas only injection? I heard that before the injection of gas solution, gas for deep wrinkle or acne scar, the gas only injection is recommended.
Precise, I use an alpha pen to perform needle subcision and gas subcision together, not just gas subcision. In the case of scars or wrinkles with really severe adhesion, you mentioned, I use alpha pen to do a subcision first with thick needle like Noco needle, like 18 gauge or 19 gauge needle, and then inject solution separately or do the 3-step treatment after that.
Thank you for your answer with your clinical case. And next question. Have you ever used cross-link hyaluronic acid fillers? If yes, please tell us tips because it seems hard to control the proper volume.
As I mentioned in my presentation, if you mean for the low viscosity filler, it can be injected by regular 3-steps mode. However, to inject the high viscosity filler, I have used the continue mode. With the continue mode, I inject sheet gas several times for subcision first and inject the solution like the filler into the space of that subcision.
Okay, thank you for your answer. Let's move to the next question. Which menu with this machine is most popular in your clinic and why?
Popular procedure, right?
Yes, right.
Also, as I mentioned earlier, I extensively use the device with PDLLA treatment such as Juverup skin booster in our procedure. As you know, procedure like PLLA like PLA are able to result in the possibility of nodules when injected in the dermal layer. However, I think that injecting CO2 gas before and after the solution with this device significantly reduce the side effect like nodules. Simultaneously, the actual results have shown much improvement when doing the procedure in this manner.
Okay, and let's move to the next question. Do you often use continuum mode? Which one is more effective to detect wrinkle? Continuum mode or manual injection or auto injection? If okay, please tell me the name of product too.
Product.
Yes.
I use the continuous mode for localized improvement such as deep neck wrinkles or scar. But for areas requiring a broader coverage, I use the manual mode to dispersion solution effectively. But for rejuvenation procedure like skin booster, like Trifill skin booster, I use the auto mode. While using various solutions for scars or wrinkles, I combine HA filler and PDRN in a ratio of approximately, I said, 1 to 3. For skin booster, I typically use with PDRN or PDLLA. I like PDLLA.
Thank you for your detailed answer. Okay, next question is, I understand that using a CO2 subcision inject reduces the risk of nodule when using PLA products like Jubelo. However, I think proper hydration is necessary as well. Can I know any tips if you have?
As you said, it is important to have a proper hydration when using PLA, like PDLNA, PLNA, and so on, a product. I use a mixing machine like Vortex to hydrate first and store it for a period of time. And then mix it again with a mixing machine like Vortex just before the procedure.
Thank you for the answer with specific example. And maybe this question is last question for the because of the time schedule. Do you also mix various solutions for rejuvenation treatment? If so, could you please tell me what product you mix, if possible?
Yeah. I can't open detailed cocktail content, as you know, due to confidential. Instead, I can share the information of materials commonly mixed in Korean clinic. As you know, hyaluronic acid, PDRN, Botox, lidocaine, and PLA, I said, are being mixed in several popular clinics.
Thank you for your good tips. And we thank you very much, Dr. Yu. Okay, we will now conclude the webinar according to the schedule. We will follow up on the remaining questions. So, many people sent us the many questions. So we will follow up many questions after the seminar. So thank you very much for your time and for watching today. Thank you.
Thank you for listening my presentation